This is our gorgeous son Jamie. He was a pretty typical baby, lots of giggles and crying and everything else. Jamie started talking and walking around his first birthday, and like all parents, we were so excited to see him develop. But then when he was 3 and a bit, we noticed he was having trouble getting his words out. At first we thought he was just trying to say too much too quickly, but then we noticed he was repeating himself more and more, and sometimes no words came out at all. That's when we started to feel really worried because his speaking was just fine up until then. We weren't sure what to do, so our local doctor suggested we needed to talk to a speech-language pathologist. At the speech pathology clinic, we learnt that Jamie had begun to stutter. The speech-language pathologist talked to us about a treatment for kids like Jamie called the Lidcombe program. We learned that the Lidcombe program was developed originally in Australia and has now been researched with clinical trials around the world with great results. The speech-language pathologist recommended we try the program with Jamie. Best of all, we were informed that the therapy is usually enjoyable for the children and parents. We were taught how to do the Lidcombe program with Jamie, and we grew confident we could do this at home with him every day. We started doing the Lidcombe program at home with Jamie that first day. Before long, we were doing the program in all sorts of places. The good thing about this was that we could do the therapy as part of our family's everyday life, and we could be pretty flexible about it. We also learned how to measure Jamie's stuttering, which was something we thought would be hard, but it wasn't. Doing those measures meant that we could easily talk to the speech-language pathologist about how much Jamie was stuttering and describe how it varied daily and across different days. Within a few weeks, we began to notice some great changes in Jamie's speech. He was still stuttering, but there was a lot less of it. Sometimes there was no stuttering at all. We're not finished yet though, and we still go each week to check in with our speech-language pathologist and to learn the next step. It feels like we are all working together to help Jamie. Jamie enjoys the whole experience, and it feels really good to be helping him.